I'm Dr. Ranjana Sharma. I'm a senior consultant obstetrician and gynecologist at Indraprastha Apollo Hospital. My special interest is minimally invasive surgery, including robotic surgery, which is the latest surgical technology in gynecology. And my other interests are urogynecology, treating menopause, and other common gynecological problems. So today I'm going to talk about the latest addition in the technology in surgical gynecology, and that is robotic surgery. So robotic surgery has a very special role in especially gynecology, because we deal with patients of infertility where preciseness at surgery is very, very important. And robotic surgery is just like another laparoscopic surgery with some robotic arms attached to the operating instruments, and this attachment gives a tremendous amount of manipulation at surgery by a gynecologist with minimum effort. When this also adds another great advantage of robotic surgery is giving a three-dimensional view to a gynecologist and extremely well magnified view. When the surgeon gets a good view with magnification, the surgery is more precise. And when the surgery is precise, the surgery is better done. And when the surgery is better done, this directly reflects on the patient's recovery. This leads to a shorter recovery time and a quick return to the normal activity. In gynecology, the area where we operate is very narrow and surrounded by very important vital structures. So injury to the adjacent organs is the most dreaded complication which can happen in gynecological surgery. And this complication can be really disastrous if I'm dealing with a patient who wants to conceive after my surgery. So whatever advantage the laparoscopic surgery gave to a gynecological surgeon, the robotic technology has added tremendously on the skill of a laparoscopic surgeon. So lots of skilled laparoscopic surgeons have also turned to robotic surgery. And the gynecologists who are not so well trained in laparoscopic surgery can also acquire this technology much more easily than laparoscopic surgery. You would like to know whether you will be operated upon by a robot. Who wants to subject her body to a robot? And I totally agree with you. And it's a misnomer. Actually, robot doesn't operate on you. We just fix the robotic instruments on our laparoscopic instruments, and then the surgeon operates on you. The robot just gives us the dexterity, which is lacking in laparoscopic surgery. That means reaching to very deep structures and hidden structures. The robotic tip, the tip of robotic arms is very small. It's 4 millimeters. So you can imagine not even a centimeter, more less than half a centimeter, and that where it is attached, that 4 millimeter instrument is attached to the main arm. That has wrist-like movement. So to a surgeon, it is like operating when we cut you open. So it is just like operating with naked eye, but much better magnification. So that I can compare robotic surgery with laparoscopic surgery, giving you a simile, like eating with hands is just like is operating with a robot, and eating with chopsticks is like operating with a laparoscope. So that's the difference. So that stiffness is not there when you have a robot attached to the arms. So now coming to which are the conditions where it has a special role. So I would say, whenever I'm operating on a person who would like to conceive later, so this is like the fertility preservation surgery, and that includes fibroids, which are a very common condition in gynecology, endometriosis, where the organs are stuck to each other, and we have to find the fine line between the two organs, and I can very well delineate or find out the plane between two attached organs and separate them more skillfully with a robot. So endometriosis, fibroid uterus, old adhesions, previous infections like pelvic inflammatory disease, and that has led to infertility. And another like tubal block, where I'm going to do a tubal surgery. This does a marvelous job. Cancer surgery. Cancer surgery involves removing lymph nodes and going to very delicate areas in the pelvis, which I already said, which is a narrow space available to me. So reaching to these lymph nodes and without injuring the adjacent structures, and on the tummy there are hardly any cuts. Like the biggest cut is about 1 centimeter. So 3-4 small cuts, that improves the morbidity. It means gives much less morbidity. Your patient is out of the bed more quickly and ready to go home more quickly, back to work quickly. So all these advantages are transferred to the patient. Thank you.